So open up your morning light and say a little prayer for I. You know that if we are to stay alive and see the peace in every eye.
Okay, so are you guys on birth control or do you use short term?
No.
What do you use?
Nothing. Wait.
Okay,
What? What's birth control?
Have you ever heard of birth control?
No. What does it do? Oh my god. Wait, I heard it makes your legs really fat, and like, I don't want to do that.
This one girl in my high school said it made her boobs bigger. But that's what I heard.
Seriously? No. But seriously, you guys don't use anything? Or use condoms?
Condoms.
I mean, occasionally.
I mean, if he has them.
Yeah, like if he has them, if not, then no.
Whatever.
You guys don't care if you get pregnant? Or STIs?
I mean,
Can you get rid of those?
it's part of life, isn't it?
Yeah, duh. Like, you can get rid of both of them.
Circle of life.
So, are you on birth control or do you use short-term methods like condoms or?
No, I'm on birth control.
Why are you on birth control?
So I don't have kids.
On birth control? Yeah. You are?
Yeah.
Do you use condoms also?
Yeah, I use both.
Okay, that's good. Is there a reason why you're on birth control? Like, is it for medical reasons or is it just because?
It's just really safe sex to be extra precautious, like birth control and condoms.
Okay, thanks. Are you on birth control or do you use short-term methods like condoms?
I am on birth control.
Why are you on birth control?
Because I have bad periods and also I am sexually active.
Okay. Are you on birth control or do you use short-term methods like condoms?
I am on neither. Sorry.
Were you previously on birth control?
Yes, I once was on birth control.
Why did you get off of birth control?
I ran out of money to pay for it.
That's true. What birth control were you on?
Yes.
That's a really
And
expensive
also
birth
the whole issue with the health problems that it caused, that was also a factor in me stopping, but it's mainly the expensive cost.
Do you remember how you got birth control? Like, did you go see a doctor or?
Yeah, I went to a doctor. They told me that I was not regular enough, so they put me on it, but.
So you were on birth control for health reasons or because you didn't want to have babies?
Both.
Oh, true. Okay, thanks. Were you ever on birth control?
Yes.
And you're not anymore?
No.
Why?
Well, honestly, it's because of the amount of hormones, your pretty natural hormones in your body. And my mom passed away from cancer, and estrogens or hormones promote growth, and so that's just like kind of being health reasons. I don't really need it to control like bad periods or anything, and I'm not really sexually active, so that is why I'm no longer on birth control.
Okay, do you use short-term methods like condoms?
Yes.
Okay. So are you on birth control or do you use short-term methods like condoms?
Oh, birth control.
What type of birth control do you use?
I use lotion.
Is it the once a day pill, or are you like afraid to use the long-term birth control like the shots?
It's the once a day pill. I'm not really afraid to use them. This is more convenient.
How come you're on birth control? Is it because of health reasons, or is it because you don't want a baby?
It's because I don't want a baby, but it's also more convenient to know when it's going to come and not be there.
Okay. How do you feel about girls on birth control? Do you think differently of girls on birth control, or not?
I feel like girls on birth control are very safe. Just because they're on birth control doesn't mean that they stick around. They're just trying to be safe with it.
Oh, so they're smarter for being on birth control.
I think so. I mean, it's healthy to be sexually active, so I think it's very safe to say.
So, how do you feel about girls on birth control? Do you have a different opinion of them because you don't have birth control, or do you think that they're smarter, or does birth control make you think that they sleep around, or what?
Smarter because I don't get a kid.
Hi, I'm Dr. Douglas Murphy. I'm an OBGYN physician in Ocala, Florida.
Okay, I'm going to be asking you a few questions. What age do women usually begin birth control?
That depends on their level of maturity and also at what age their parents feel they want them to start birth control, but most young women will come to me between the ages of 17 and 22 to start birth control pills or some other method of birth control.
What is the process of getting birth control?
It depends on whether they go to a private physician or whether they go to the health department. You can go to your family doctor, you can go to your OBGYN physician, you can go to the health department.
What's the process of getting birth control?
Usually a young woman will go to either her OBGYN physician or to the health department or to a family doctor and request birth control pills or another method of birth control.
Are there any tests that you have to complete before obtaining birth control?
Usually a history and physical examination, or at least an ultrasound of the pelvis is done to make sure that there are no pelvic anomalies. It's not necessary to have a pap smear done. In fact, the new pap smear guidelines call for women to not get pap smears before the age of 21. So it's not necessary to have a pap smear before starting birth control pills if they're under that age.
Do young girls prefer things like maneuvering because they require less thinking?
Sometimes, but a lot of young women have a problem with inserting the NuvaRing into the vagina, and therefore taking a birth control pill or using another method is a lot of times preferable, even though the NuvaRing is in some ways easier. There's also something called the Ortho-Evra patch, which is the same thing as a NuvaRing, except it's a patch that's changed every 7 days, so it makes it a little bit easier to take than a birth control pill, which you have to take every day. But there still is some remembering you have to do.
How do you feel about the shot?
Depo-Provera shots are very effective at birth control. The problem with them is that if you read the package insert, they recommend that you only use them for 2 years maximum, and they can cause some problems with weight gain, and they can cause some problems with irregular bleeding. The other issue is with longer than 2 years of usage, you also have bone loss, which can occur. Now that usually is reversible when you stop the shot, but for women who take the shot for many years, it can be a significant problem with development of osteoporosis later on in their life.
Would you say birth control is easy to access?
Relatively easy. You can't go to the local pharmacy and just get some. You have to go through an examination, or at least an evaluation by a physician. But it's relatively easy to access. Yes.
Would you advise that young women begin using birth control?
Well, it depends on the young woman, and it depends on her level of maturity. It depends on her history, her family history. There are a lot of factors that would prevent me from prescribing birth control to young women, especially if there's a family history of clotting disorders, if there is a history of problems with remembering medication. If a young woman is not responsible, the pill only works if you take it on a regular basis. So if you're not going to be responsible and take it, it's actually a potential problem. If there's any family history of clotting disorders, then there can be a problem with increasing the risk of blood clotting in the legs, and then therefore pulmonary embolus can happen, and that's a deadly situation for the patient. So it's a problem that we have to face every day in medicine, but most young women are good candidates for the pill or other methods of birth control.
What age group usually comes into the office inquiring about birth control?
Usually it's women in their 20s and 30s. That makes up the majority. By the time most women reach their 40s, they've made a decision about either a permanent method of birth control, such as tubal ligation, or some vasectomy for their husband. But 20s and 30s are probably the most common time for women to request birth control.
Ah!